Hi everyone, to all my dear doctors, welcome to the 𝗏𝗏 where we are discussing the blood and serious part of microbiology infections, and this is going to be not class 13 but this is going to be our class 14. Sorry for the misprinting. So this is the class 14th and we are discussing the Babesia. Okay. So my dear friends, what is Babesia? So if you have attended my general parasitology class, the Babesia is a protozoa. Okay. So Babesia is an intra-erythrocytic protozoa. That means it loves to stay inside the RBC. Can you see here? This is the RBC and this inside is the Babesia. Babesia, like any other infection, is responsible for causing fever. But since Babesia is inside the RBC, it can cause hemolysis and hence it is causing hemolytic anemia and hemoglobinuria. Okay. Now, what is the risk factor? What is the risk factor? So, the risk factor is the patients who are immunocompromised and splenectomized. That means they have undergone splenectomy for some reason. Okay. Why? Because the spleen is not functioning, they lack the removal of infected RBCs. The infected RBCs can't be removed, so Babesia is going to have a good survival. And obviously the immunocompromised patients like HIV patients. Okay. So Babesia is very commonly seen with HIV. Please remember, this is important question previously asked. So Babesia is transmitted via the bite of the hard tick. That's the most common one transmission for Babesia. And remember, this hard tick is called as 𝗖𝗵𝗵𝗿𝗺 tick. Okay. So remember, very important thing, Babesia enters the RBC as sporozoites and gets matured into trophozoites ring form. Okay. So entering as sporozoite. If you have seen the lecture of malaria, they also enter as sporozoite, and in the RBCs they form the trophozoite ring forms. Then the trophozoites are going to mature as merozoites, which have got Maltese cross or a tetrad structure. So what is happening? Entry as the sporozoite, then maturing into trophozoite, then further maturing to form merozoite. Merozoite, M for Maltese cross. Okay. So if I just make a small diagram for you, this is how the Maltese cross look like. Okay. And this is unique. Okay. So this is unique. Otherwise, it is very similar to falciparum, but Maltese cross is unique to malaria. So which course are you doing? MBBS. Please remember, M for Maltese cross and B for Babesia. Okay, clear? Now, one more important thing, see here. Can you see this picture clearly? Yeah, this one. So this is the tetrad or the Maltese cross. How will you treat? The treatment is with the two drugs, azithromycin and atovaquone. But azithromycin is something that is given more commonly, so just remember this. This marks the end of our this small topic, Babesia. Thank you so much for watching and stay connected with us for the future classes. Thank you.